Hello and welcome. Today, we're diving deep into a condition that affects the urinary system: urethral fibrosis. This condition, often underestimated, can significantly impact a person's quality of life. We'll explore what it is, what causes it, how it's diagnosed, and the available treatment options. Let's get started. So, what exactly causes urethral fibrosis? The primary culprit is often injury or inflammation to the urethra, the tube that carries urine from the bladder to the outside of the body. Common causes include traumatic injuries like pelvic fractures or stratal injuries, infections like sexually transmitted infections or recurrent urinary tract infections, surgical interventions like catheterization or endoscopic procedures, and radiation therapy to the pelvic region. In some cases, the exact cause might remain unknown, termed idiopathic urethral fibrosis. Now, let's understand the pathophysiology, or how urethral fibrosis actually develops. Repeated injury or inflammation to the urethral lining triggers a cascade of events. The body initiates a healing process, involving the deposition of collagen and other extracellular matrix components. Over time, this excessive collagen deposition leads to scarring and narrowing of the urethra. This narrowing, or stricture, obstructs the flow of urine, leading to various urinary symptoms and potentially causing further complications upstream in the urinary system. Understanding who's at risk is crucial. While urethral fibrosis can affect individuals of any age and gender, it's more commonly seen in males. Factors that increase the risk include a history of urethral instrumentation, such as frequent catheter use, previous urethral surgeries, sexually transmitted infections, and pelvic trauma. Those with underlying conditions that impair wound healing, such as diabetes, may also be at a higher risk. The signs and symptoms of urethral fibrosis can vary depending on the severity of the stricture. Common symptoms include a weak or spraying urine stream, difficulty starting urination, frequent urination, urgency, pain or burning during urination, incomplete bladder emptying, and recurrent urinary tract infections. In more severe cases, individuals may experience urinary retention, where they are unable to pass urine at all. It is important to note that these symptoms can overlap with other urinary conditions, so a proper diagnosis is essential. Diagnosing urethral fibrosis involves a comprehensive evaluation. This typically begins with a thorough medical history and physical examination. Diagnostic tests may include a uroflowmetry, which measures the rate of urine flow, post-void residual volume measurement, to assess bladder emptying. Erythroscopy, which involves inserting a small camera into the urethra to visualize the stricture, voiding cysterothrogram, VFU, and X-ray that shows the urethra and bladder while urinating, and urine culture to rule out any underlying infections. Urethral fibrosis can be classified based on the length, location, and severity of the stricture. Strictures can be short or long, single or multiple, and can occur in different parts of the urethra. Classifications can also be based on the degree of obstruction, ranging from mild narrowing to complete blockage. Accurate classification is important because it helps guide the choice of treatment. Treatment options for urethral fibrosis vary depending on the individual case. The goal of treatment is to relieve the obstruction and restore normal urinary flow. Options included dilation, which involves widening the stricture using progressively larger instruments, urethrotomy, where a small incision is made in the stricture to open it, urethroplasty, which is surgical reconstruction of the urethra, often involving grafting tissue from another part of the body. And in some cases, temporary or permanent urinary diversion may be necessary. The best treatment approach will depend on the length and location of the stricture, as well as the patient's overall health. Preventing urethral fibrosis can be challenging, but certain measures can help reduce the risk. These include practicing safe sex to prevent sexually transmitted infections, avoiding unnecessary urethral instrumentation, like frequent catheterization, promptly treating urinary tract infections, and seeking medical attention after pelvic trauma. The prognosis for urethral fibrosis can vary. While treatment can often relieve symptoms and restore urinary flow, recurrence is possible. The success of treatment depends on factors such as the length and location of the stricture, the chosen treatment method, and the patient's overall health. Recent research focuses on developing less invasive treatment options, such as drug-eluting stents and tissue engineering approaches, to improve long-term outcomes and reduce the risk of recurrence. These advancements offer hope for individuals affected by this condition. Thank you for joining us on this informative journey into urethral fibrosis. Stay informed, stay healthy,